We're going to try and get you out of here and get you discharged. We're your nurses. My name is Madison,
And my name's Kevin.
and we're just going to teach you about your diagnosis today. It looks like you were diagnosed today with diabetes mellitus type 2. Diabetes is elevated glucose levels in the blood. This is most often caused by insulin resistance. Insulin resistance happens when the cells resist transport of glucose in the cells where they can be used as energy.
And so when that transport doesn't occur, that glucose stays in the blood. And so it'll be important to be monitoring your blood glucose levels in a few different ways. One of which will be at home using a glucometer, where you'll be able to prick your finger and test your blood glucose levels on your own. Additionally, we'll also seek treatment as well and get A1C tests regularly. This will be coming into a lab or an office where they draw some blood and they will be able to test your blood glucose levels over the course of time by seeing how much sugar has bonded to the red blood cells. And your provider will go over how frequently this will need to occur.
We also wanted to talk to you about how to change your lifestyle to keep your blood sugars in your blood low. You can do this by avoiding foods that are high in carbohydrates. This includes bread, cereals, rices, potatoes, pastas, beans, and corns, and things high in sugars like fruit or milk or yogurt or sodas, candies, cookies. We suggest that you replace these with greens such as carrots, green beans, eggplants, mushrooms, asparagus, things like that. We also wanted to talk to you about exercise. We recommend getting at least 150 minutes per week of moderate intensity activity or strength training 3 times per week. This improves insulin sensitivity and allows that transport back into the cell.
Another lifestyle change that will have an impact will be reducing the amount of alcohol consumption that you have. You should consume about 2 or less drinks per day. And alcohol can be high in carbohydrates, but it can also depress the release of carbohydrates from the liver. And so basically what that means is alcohol in general can increase the blood glucose levels that you may have. In order to reduce the effect, if you are going to have some drinks, we recommend that you drink with a meal as opposed to on its own. And similar to what we've talked about, it'll be important for you to monitor your blood glucose levels if you are regularly consuming alcohol or consuming a significant amount.
The most common complication of diabetes is diabetic retinopathy. This is just a fancy word for blindness. This happens when your blood cells get inflamed and have a lot of sugar in them and causes the blood and fluid to leak out into the retina, the back of the eye. And this leads to symptoms of dim vision, constant tearing, and light flashes. So one of the medications that we're going to send you home with is metformin. This is the first line drug that we use for diabetes mellitus type 2. The way that it works is it stops your liver from producing as much sugar, as well as it stops the absorption of sugar in your intestines. Metformin is not a cure for your diabetes, but it can manage it long term, which means that you will be on it for a while. To take this medication, you'll take it twice a day, at the same time every day. If you forget to take it, that's okay. You'll take it when you remember, or if you're close to the next dose, then just take 1 pill. Try not to use alcohol while on this medication. It can cause abdominal pain or GI discomfort, so you should take it with food. You should also let your future medical providers know that you are taking it, as it can interact with some other medications or contrast dye if you need medical imaging. It's typical in the future to need additional medications in addition to metformin due to the progression of diabetes, and that would be regular insulin.
Okay. So after you leave today, there may be times where you do need to seek additional medical treatment. One of those instances is if you're experiencing an episode of hyperglycemia. So if you are regularly testing your blood sugar levels, if your blood sugar reads over 400, that would be a time to come into the emergency room. If you're not testing your blood sugar, you can also notice hyperglycemia as if the odor of your breath is fruity. You're extremely thirsty, like unquenchable thirst. You're frequently urinating, or you have signs of nausea, vomiting, abdominal pain, or feeling weak or fatigued. Additionally, hyperglycemia can have significant impact on your kidneys function, and metformin can also have an impact on your kidneys functions. So if you are experiencing any signs or symptoms of reduced kidney function, so this would be infrequent urination, highly concentrated urination, or feeling signs of changes of cognition or confusion, those would be times to come into the emergency room. Additionally, the result of those can also lead to lactic acidosis, so buildup of lactic acid in your bloodstream. The signs and symptoms that you would notice if you have those would be rapid breathing, extreme fatigue and weakness, muscle pains and cramps, or nausea and vomiting. So those would also be times to come and seek immediate medical treatment.
One thing that diabetes does is it suppresses your immune system and can cause you to have poor wound healing. We want you to come to the emergency room if you have a wound that lasts longer than a couple months or any wound that has signs of an infection. So, swelling, pain, redness, drainage, discharge at any wound site, so that we can get that started healing for you so that it doesn't lead to amputation.
Okay, so I know this was a lot of information to go over pretty briefly, but if you don't have any questions now, you can always reach out to your provider with those additional questions, and then we'll go ahead and walk you out. Thank you so much.